The musculoskeletal pain is very direct. We just maybe we talk a little bit on how we help in these two organs. What kind of people that will benefit from visceral manipulations in terms of these two organs?
Okay.
Yeah. Okay. Right. So if we have about
Yeah.
then we can start. We can start anyway.
Yeah, we can start now. I mean,
so should we start now, everyone? Hi. Okay. Today the topic is our little friend, pancreas and spleen. Okay, it is not usual organs that we manipulate every day, but it's very important organs because it is connected closely with a lot of organs in the center part of the body. All right. So pancreas is just behind the stomach. Okay, pancreas behind the stomach, and it's attached closely to the duodenum. The duodenum is here. All right, it is wrapped by the duodenum. All right, and it's connected through the gallbladder via the common bile duct. Okay, common bile duct. So we have to look at the connections in between all these organs, and the tail of the pancreas connected to the spleen, all right, which is hiding beneath the rib cage of 9 to 11. All right, so we will talk about the pancreas first, the symptom of pancreas and the anatomy of the pancreas. So the pancreas, when I manipulate pancreas in the clinic, I always manipulate through the duodenum, through the common bile duct, because it's very closely connected. And the common bile duct, you know, the pancreatic duct join with the common bile duct before they empty into the duodenum through the sphincter of Oddi, all right? The ampulla of we call it sphincter of Oddi, all right? So any dysfunctions that happen in the gallbladder or common bile duct, even the fibrotic changes in the we call it sphincter of Oddi, can affect the pancreas. So today we will talk mainly on the pancreatitis. Yeah, the one that will give you a lot of musculoskeletal pain. The diabetic, because it's the functions of the endocrine system and the exocrine system. Sometimes you won't feel a lot of musculoskeletal pain, but acute pancreatitis will give you a lot of pain due to the irritations of the nervous system, the vagus nerve, because it's and the celiac plexus, you know, that is near the celiac plexus is the nerve will innervate the pancreas and also the vagus nerve. All right, so you will have a lot of musculoskeletal pain through the inflammations of the pancreas. So when we other than musculoskeletal pain, people who has acute pancreatitis or chronic pancreatitis, when it is too bad, these people will always feel abdominal pain when they have full stomach. Remember, the stomach is in front of the pancreas, and there is a small space here. We call it omentum bursa. So now you need to glide the stomach. You need to free up the space here to free the pancreas from compression. So when you have a full stomach, right, and immediately after eating, you feel that you have abdominal pain, and you have this tendency to lean forward, bend your hip, okay, curl towards the pancreas, maybe sleep on your chest. You may have the lesions from the pancreas, because when you have full stomach, you want to lean forward so that your stomach falls forward and it's not compressing. So people might feel more symptom when you are lying supine. When you lie supine, your stomach are on top of your pancreas, so you will feel a lot of pain. So this is the dysfunction. So this I mean, I'm talking about symptom already, sorry. But this is mechanical. Yeah, the one that I remember, okay, just in case. All right, so this is I'm so sorry. Okay, so this is the mechanical you talk about the mechanical problem. Okay, the symptom. And what else? I think I will let you talk about the musculoskeletal symptom of
Yeah.
the pancreas problem.
Yeah. I mean, so when we talk about symptoms, yes, it's a very, I think most people are concerned is actually like same thing what we were discussing is actually the pain, okay? So from Evelyn was sharing just now, because a pancreas is a very, I would say it's very sensitive organs, okay? It's very delicate compared to other organs like the one that we were talking about yesterday, the kidney, the stomach, the liver. Okay, so much more delicate because there's a lot of blood vessels and also these nerve surrounding and covering the pancreas. So that's why when we work on it, we have to be very, very careful with it, or else it will cause more problem instead of helping you guys. And so yeah, because the location of the pancreas is actually at this in front of the spine, so it will cause back pain, okay? And it can actually radiate sometimes to your chest, to your what do you call this, the pelvis, that area. So it can actually radiates up and down as well. So when you guys sitting too long, like especially like when we are sitting in front of computer, okay, I think most of us right now during this MCO period, I believe most of us are working in front of computer, okay, sitting for a long time, and it may cause this back pain, especially the mid back, okay. If you look at the position of it, it's actually the mid back of the spine, okay. So if you guys have any questions, or any things, you can actually ask us. If let's say you want to share with us, if you guys say have this pain, okay.
I think it's a mid to lower back pain.
Yeah,
normally will affect mid to lower back, yes.
Okay.
For the pancreas.
Yeah,
And also not forgetting the levator scapula on the left side.
And
due
also,
to fracture. Yes, the levator, the scapula, the mid scapular pain, the media part, levator scapula. So also a symptom from the pancreas because of the nerve connections. Nerve connection, T9, T5 to T9, the splenic nerve, right? The greater splenic nerve. So this is the symptom, the musculoskeletal symptom caused by the pancreas. And also the physiology, some of the symptoms that you can see is other than the having stomach pain when you are having full meal. When the inflammation is so strong, you might have guarded abdominal muscles, like the peritoneum is very, very tight. So you will have a very hard abdomen, muscle guarding. The posture will be more leaning forward. And your stool will be very, very pale because the enzyme, the juice, the pancreatic juice are not secreting. Yes, not secreting well. So the digestion of the fat, protein, and carbohydrate will be impaired. So when you come out as more like an indigestion problem, more like on the physiology part of the view, not musculoskeletal. Maybe this, a lot of people they might ignore. They might not know that this is a sign of the pancreas. A lot of people come to see us for more on the pain on the spine, neck.
Yeah.
But this is the small little sign and symptom that we can pick up at home.
That's true.
Chronic pancreatitis, So this is something.
Sometimes I advise my patients to take note on these little daily things, okay, that sometimes we may neglect, okay, because we thought like, it's just going toilet and then we just excrete out what is the waste, okay. But sometimes we actually have to look at it, to find out what is actually happening to our body as well. So as like what Evelyn was sharing, that it's a bit pale and is it greasy, kind of the stool. So
digested food, yes.
So I think because of the the pancreatic enzyme is not able to secrete it, okay, where it actually transfer to the stomach. So the stomach is not doing their job properly because of the pancreas. So that's why the digestion, having some issue there, okay. And anything else you want to share, Evelyn?
Not only that, I think people who has chronic pancreatitis, eventually if we don't address the problem, because you won't know whether the problem comes from the pancreas itself or it's because of dysfunctions and of spasm of the duodenum. So when you have a high tone inside the duodenum, or the bowel juice or this sphincter of Oddi is very tight due to the dysfunction of the muscles here, or the spasm of the duodenum, it will also affect the flow of the pancreatic juice into the duodenum. So the symptom might be related to the, we call it duodenum spasm. Okay? And duodenum spasm will always cause the spine, the low back pain at the L1, 2, 3. So it is about the same level as the pancreas. So when you have the mid to lower back pain, all right, there are many things that might contribute to it. So as a visual manipulation therapist, we will be able to address, right? We have to do the GL, general listening, local listening to find the culprit of the back pain. But a lot of time I address the duodenum to free the sphincter of OD and also improve the functions of the pancreas so that they are not tight. They can glide freely on the spine. Yeah, so the spine can move as well. Yeah. So I think that's all for the pancreas. So let's go to spleen. Yeah, so spleen, rib cage. Yeah, rib 9 to 11 beneath your diaphragm. So it's just tucked underneath the diaphragm. They go inspire, expire, like this. So this is our terminology. Like we have this movement, and also glide mobility wise, it goes with the inhalations, exhalation, inhalation, exhalation, and it's closely attached to the stomach through the ligament. Pancreas, the tail, all right. And also on top is the diaphragm. Beneath the spleen is the descending colon. And behind the pancreas is the left kidney. So you can see that there's a lot of structures which can affect the spleen mobility. Okay, so anything happen to all the neighborhood organs can affect the functions of the spleen. All right. Spleen also very fragile during a fall on the rib or accident, right? Whiplash accident, like 3 major organs that can injured after a whiplash is the liver ligament, stomach ligament because the stomach that is attached to the diaphragm, and also the spleen ligament. So these 3 organs that we always want to look at after a whiplash. Yeah, but we do not handle the spleen right after whiplash because the kinetic force might cause this spleen to rupture. So like within 6 months that we were advised, within 6 months of whiplash or accident or motor vehicle accident, we do not handle spleen. Yeah, do not manipulate the spleen. So like the spleen dysfunction, there are many musculoskeletal symptoms compared to pancreas because of the attachment of it behind beneath the rib cage. So I think Alvin can share with us the symptom.
Yeah, I mean again, so same thing, the pain, and one thing, because there's a question right here I saw from JS Lam. Okay, but we will continue we'll answer the question later. Yeah.
Yeah, I can read the use of contribute to chronic pancreas. We'll talk about this one later.
Yeah. So yeah, I mean pain, and then would that be a restrictions on the left side of your ribs, okay, and also it may also cause the pain on your neck as well around the C4 until C6.
Yeah.
4, C5, C6. Okay.
Yes.
So these are the musculoskeletal pain that we can actually or more commonly seen in our patients. Okay, and then plus from that we also get tired easily, okay, when we wake up, because if let's say you guys know the anatomy of the spleen or what's the function of the spleen, it's actually they actually help us to store these red blood cells and also these white blood cells as well. So if let's say
they also filter, I think they also filter the dead red blood cells. Yeah, they filter them.
Yeah, so it's actually they help us in our immune system. Okay, so it will, of course, if let's say there's something wrong with the spleen, your immune system is gonna be decreased. Okay, then you are easily get infections or get fever, you know, and of course the iron deficiency, because we were talking about these red blood cells, where they are not able to produce or not able to filter these dead blood, okay, red blood cells. Okay, so you may have this kind of issue where you are having this anemia. So there's one thing that we can take note about from the spleen itself, besides from this pain on the neck and also the rib cage, whether there's restrictions. Yeah, you want to
So I
go
think
back?
that there's one more thing that the spleen will cause, because the spleen tucked underneath the diaphragm, all right? And the diaphragm are innervated by the phrenic nerve. So when there's a problem with the spleen function or restriction in the spleen, it will cause periarthritis on the left shoulder. So you have a lot of chronic inflammation, capsulitis. That we thought that it's a frozen shoulder, you thought that it's a shoulder joint problem, but in fact, it might come from the spleen restrictions. Yeah, and the spleen restriction will cause a lot of muscle spasm at the thorax also, because of the restriction in the diaphragm. It will cause a stitch. We call a stitch, right? It feel like a cramp, a twitch in your intercostal muscles, and you thought that what is that, right? It could be because of the spleen are irritating the nerve, right? And I deal a lot of low back pain, left low back pain with the spleen manipulation, because the spleen are attached to the descending colon. So when the spleen phrenic colic, like splenic flexures, right, attached to the diaphragm. So if spleen are restricted, it also cause the mobility or the peristalsis of the descending colon on the left side. So you will have a problem with the back pain, because the fascia might be too tight. You cannot do a proper right side bending. Your straight leg raise will be limited because the spleen is affecting the fascia. And you will have SI joint issues on the left side. Same thing, because the left sciatic, according to Jean-Pierre Barral, he said that left sciatic is we call it dumping bucket. So a lot of issue will dump to the left sciatic. I think spleen dysfunction is one of them.
Okay. Yeah. Okay. And then maybe Evelyn, you want to answer there's a question there.
Okay, the chronic pancreatitis. Okay, now how do we address the we through many manipulations, we will improve the vascular. If a visceral manipulation therapist have attended the vascular cause or the nerve cause, okay, we will be able to free up the fascia, the surrounding fascia that restrict the motility of the pancreas. From the day one till now, we have been talking about motility. Motility of every organ, we call it intrinsic movement. Yeah, so they have to move. All right. For unlike a kidney or spleen, the pancreas don't move up and down. There's not much mobility, but the pancreas has more motility. It's like a worm moving. So you must have this movement of the pancreas in space to have the optimal functions of the spleen or the pancreas. So for this visceral manipulation therapists, we will free up all the fascia, because the pancreas are attached to the transverse colon also. So all these surrounding tissue will cause a restriction on the pancreas. So if they lost motility, the blood flow is weak, and the pancreatitis is, the pancreatitis, if the pancreas juice cannot empty properly into the duodenum through the common bile duct, right? They will have a problem with the exocrine. They'll have problem with the exocrine. So we will improve the gliding of the tube, okay, free up so that they won't become so spasm. And we have to address the duodenum as well, to glide the duodenum, free the duodenum, and let them become soft, and the tone or pressure in the duodenum becomes softer, so that the pancreas juice can go out into the duodenum properly. And it can also help people who will have ulcer in the duodenum. Yeah, because if pancreas juice and the bowel juice are alkaline, they are helping the gastric juice to become neutral when the stomach empty the food into the duodenum. So if the pancreas juice and bowel juice cannot secrete properly into the duodenum, so people might have ulcer in the duodenum due to the high acidity. So we are going to work here to free up the fascia, get the tube flow properly, and improve the blood flow into the pancreas to address the pancreatitis. Yes, the chronic pancreatitis. And of course, you have to address diet as well. So our teacher always advise people, when we manipulate the organs, you have to go back and look after your diet and emotion issues. Just now when I talk in the Mandarin sessions, the deep sorrow will greatly affect the functions of the pancreas, because pancreas handle a deep grief. So when you lost someone that's very dearly suddenly, your body or emotion might not able to handle, and in a short period of time you might develop a diabetic, because your pancreas are being stressed. So it lost the normal function. So some people who suffer from emotional issues, we can help them by freeing the restrictions from the pancreas.
Okay.
Okay, I hope that I addressed that answer questions. If give us a note if you think that I answer your questions. Yeah. Okay.
And just give like a thumb up, or yeah.
Yes. So like when we
can just no, I'm just saying that if let's say I have other questions, I mean,
yes, thank you. So when we work with visceral manipulation therapists, we are like we urge our clients not to see us when you have pain. Sometimes we also can help people who has a chronic diabetic, because when we help, we can we call it improve the functions of the spleen, of the pancreas, okay, and also improve the function of the spleen, which will increase the immune system, okay, which might manage your diabetic symptom. Like John Marathi in Seattle, when I attend the advanced visceral manipulation technique with him regarding the pancreas and the kidney, he said that he has a program for his client who have chronic diabetic. All right, course of 6 months. So he will address the functions of the organs, and also change their diet and habit of food. And these people who has chronic diabetes will slowly wean off insulin in the course of 6 months. So I do not overpromise. Huh? You can't hear me? Can you hear me now? Hello? Can anyone hear us? No? I can't hear you. Something is wrong with your audio. Can anyone hear us? No? Something is wrong? Can the rest hear us? Yes, Alvin, the rest can hear me. Okay, it's all right. I think it's always problem with your, okay. It's almost done. Anyway, it's almost done. If you have other questions regarding these two organs, all right, you may drop us a note later. So these two organs doesn't cause much musculoskeletal problem. Just take note, when you have a chronic left shoulder, you can look for us. We will help you to we call it analyze what organ causes the shoulder pain, because there are so many organs that can cause shoulder pain, other than the spleen. Alvin, I think we will end it. I will end the sessions. Okay. So everyone, thank you for, okay, it's all right. Thank you for joining us in this session. Hope that you can join us tomorrow for a topic on the pericardium and lung. Okay, it's very interesting topic to know if you have a chronic neck problem as well, because these two organs affect our cervical area a lot. So tomorrow will be a big topic. Okay, I mean, I'll talk to you later. Okay, bye everyone. Thank you for joining us.